Berberine is known for treating diabetes, improving cholesterol, lowering blood pressure, boosting mood, and it's a neuroprotectant. It's a natural plant alkaloid and it's been used for millennia in traditional Ayurvedic and Chinese medicine to treat diarrhea and gastrointestinal issues. Berberine is a unique and powerful dietary supplement with nootropic benefits. Research and clinical experience in the last 5 years demonstrates berberine's ability to provide positive effects on blood sugar, cholesterol, heart disease, blood pressure, autoimmune disease, inflammation, weight control, gut problems, cancer, and Alzheimer's disease. Berberine has recently been shown to help to control blood sugar as effectively as the prescription diabetes drug metformin. But even if you're not concerned with diabetes or pre-diabetes, you might find benefit in adding berberine to your diet. Our modern Western diet is detrimental to overall health, and particularly to cognitive health. Berberine can be a powerful ally in achieving and maintaining the optimal performance. Supplementing with berberine has been shown to increase the levels of serotonin, dopamine, and norepinephrine in the brain. Berberine preserves long-term potentiation in the synapses that's normally lost from diabetes. Berberine increases adenosine monophosphate activated protein kinase, or AMPK. This enzyme, AMPK, is the master metabolic switch in each of the cells. When AMPK levels increase, you get an energy boost. Blood glucose is regulated. Insulin sensitivity improves. You get reduced triglycerides and increased fat burning in the mitochondria. Berberine is a bright yellow alkaloid extracted from plants like the Indian barberry, Oregon grape, and golden seal. Plants containing berberine have been used in traditional Ayurvedic and Chinese medicine as an antibacterial, anti-inflammatory, anti-diarrheal, antimicrobial, anti-protozoal, and immune-enhancing therapy for thousands of years. Out of the 4,434 clinical studies for berberine listed on PubMed, over a third of these have been published in the last 5 years. Berberine is one of the few nootropics known to activate AMPK. This is especially relevant if you're diabetic, pre-diabetic, or overweight, all conditions that negatively affect cognition. The enzyme AMPK is the metabolic master switch inside each of the cells, and is critical for regulating cellular metabolism, including lipid, glucose, and energy imbalances. The AMPK directly influences brain cell energy, function, repair, and maintenance. Berberine activates AMPK, and AMPK activation boosts fat burning in the mitochondria. Studies have shown supplementing with berberine prevents fat accumulation in the body. A study in phytomedicine had obese human subjects take 500 milligrams of berberine 3 times per day for 12 weeks. The result was a reduction in body weight, blood lipid and hormone levels normalized, and inflammation went down. Berberine activates AMPK and it increases its phosphorylation, the high energy exchange in a brain cell. And this elevates the AMP to ATP ratio, and it reduces oxygen consumption. This increase is called glycolysis. This suggests that berberine enhances glucose metabolism through the stimulation of glycolysis, which is related to an inhibition of glucose oxidation in the mitochondria. More efficient mitochondria protect from oxidative stress, and this means better brain function and memory. Berberine supplementation helps to control food intake, and it operates as a memory enhancer, helping you to cut down on weight gain, reduce the likelihood of metabolic syndrome, and helps to prevent or control type 2 diabetes. Glucose is the primary source of energy for every cell in the body. Because your brain is so rich in neurons, the demand for energy uses half of all the sugar energy in your body. Learning, memory, thinking, or cognition are closely linked to glucose levels and how efficiently your brain uses this as a fuel source. If there isn't enough glucose in the brain, neurotransmitters are not produced and communication between the neurons breaks down. Hypoglycemia is a common problem with diabetes, caused by low blood sugar levels, and this leads to a loss of energy for brain function, and is linked to poor attention and cognitive function. Problems with blood sugar and type 1 or type 2 diabetes affect the brain cell connectivity. This causes the brain cells to shrink, and it restricts cerebral blood flow, causing major problems with cognition. And if severe enough, it promotes the development of dementia. Berberine helps to prevent this cognitive decline by controlling the blood sugar and the brain cell metabolism. Studies show berberine inhibits acetylcholinesterase activity, and this increases glucagon-like peptide. The enzyme acetylcholinesterase breaks down acetylcholine, and this is critical for concentration, focus, and memory. By preventing the breakdown of acetylcholine, more of this neurotransmitter is available for learning, memory, and recall. GLP-1 is a peptide hormone, and it plays a crucial role in controlling diabetes, and it's involved in cognition, learning, and neuroprotection. Studies have shown GLP-1 enhances synaptic plasticity in the hippocampus, and it reduces the aggregation of amyloid beta protein and the microtubule associated protein tau, which is linked to Alzheimer's disease. Increasing the GLP-1 with berberine increases neuroplasticity, and it reduces protein aggregation, resulting in increases in long-term potentiation and improvements in long-term memory. Most of us in the Western society suffer from chronic nutritional overload. Overeating or not eating the right food in the right amount messes with the uptake of glucose and fat from our blood for effective energy regulation. The result is an accumulation of cellular waste and damaged proteins. This impairs genes that would help us to live longer and boosts genes that cause inflammation. As the cells in our body and our brain consistently deal with overnourishment, the enzyme AMPK decreases. This results in weight gain, diabetes, neurodegenerative diseases, and ultimately premature death. Decreases in AMPK activity result in chronic inflammation, accelerated aging, high cholesterol and triglycerides, increased belly fat, insulin resistance, mitochondrial insufficiency and dysfunction, and neurodegeneration. The consequences to brain function of low AMPK activity results in decreased alertness, brain fog, slower thinking, poor memory, and a decline in mood. Berberine has been used for thousands of years as a treatment for bacterial infections, fungus, protozoa, viruses, chlamydia, and candida. It helps to protect against cholera and E. coli. It's used as an anti-diarrheal and to reduce inflammation. Up until a few years ago, you'd find berberine in the pharmacy section for gastrointestinal issues. In the last 5 years, research has shown berberine to be effective for treating diabetes, metabolic syndrome, inflammation, and even cancer. Berberine is gaining a reputation for its anti-diabetic effects, helping to prevent or to treat type 2 diabetes. It helps with glucose metabolism, maintenance of healthy lipid levels, both LDL and HDL. It improves insulin sensitivity. It helps to lower blood pressure, weight management, the immune system, and to boost cognition. Research shows berberine can provide anti-aging benefits by extending the life of telomeres, and studies have found it's able to suppress the growth of several different types of tumour and cancer cells. Reviews from people using berberine frequently mention a lift in the mood, likely because it provides a significant increase in the neurotransmitter dopamine, norepinephrine, and serotonin. Berberine can also help to prevent Alzheimer's disease because of its effect on beta-amyloid pathways and the enzyme that degrades acetylcholinesterase. If you start feeling shaky between meals, get a little dizzy or nauseous, or feel like your mood has taken a sudden turn south, you might want to try berberine. Many users report how supplementing with berberine has made a dramatic change in how they feel and the quality of their life. It can take up to a month to begin to feel dramatic changes. Many report seeing a positive change within a few days. Sugar cravings disappear, no sugar crash late in the afternoon. Energy levels rise and stamina increases. Many find thinking is easier and quicker. Brain fog is no longer a problem, and mood is much better. Berberine helps with weight loss, so you might find your waist getting smaller. It might not be a dramatic difference, but you'll feel better. Many people report a greater improvement in symptoms when switching from metformin or statins to berberine. Berberine is proven to help to regulate your blood sugar. Berberine can increase neurotransmitter levels, so a boost in dopamine and serotonin can put you into a better mood. Many report skin conditions or gastrointestinal issues brought on by stress are no longer a problem. There's less indigestion and heartburn. If you've got blood sugar issues, you might not realize how bad you feel until you start feeling better by adding the berberine to your diet. A lot of research lately has centered around using berberine to treat various problems associated with diabetes. The latest figures released by the CDC in the US report 29 million people have diabetes. This number was up from 26 million in 2010. The CDC went on to say that 1 in 4 people with diabetes don't know that they have it. Another 86 million adults in the US are pre-diabetic. That's 1 in 3 American adults. Pre-diabetes means the blood sugar levels are higher than normal, but not high enough to be classified as type 2 diabetes. And this is not just an American problem. The World Health Organization reports that as of 2014, 422 million people worldwide are dealing with type 2 diabetes. Those with type 2 diabetes are more apt to get Alzheimer's or some other form of dementia. If you're diabetic or pre-diabetic, learning, executive function, and psychomotor performance can all suffer. All the brain functions affected by diabetes and its causes can be repaired and maintained with the use of the right supplements and the change in diet. The most important nootropic supplement in the management of diabetes appears to be berberine, and its effect on brain function will help anyone with their working memory and brain optimization. Problems with memory are often associated with how brain cells use glucose, by oxidative stress, and by cholinergic dysfunction. Research has found that treatment with anti-hyperglycemics that affect the blood sugar, with antioxidants, and with cholinergic agonists boost memory. Berberine works as an antioxidant, and it's an acetylcholine esterase inhibitor. A study in India was done with diabetic rats with severe learning and memory problems. The rats were given 25 to 100 milligrams per kg of berberine twice a day for 30 days. Learning and memory improved, along with the hyperglycemia, less oxidative stress, and more cholinergic activity. Diabetes kills brain cells. It negatively affects synaptic plasticity and long-term potentiation in the brain. This causes problems with learning and memory. Researchers in Iran working with diabetic rats were able to restore the learning and memory with 100 milligrams per kg of berberine per day. Researchers in Korea gave berberine to rats 30 minutes before injecting them with scopolamine. The team found that using the berberine improved the memory impairment caused by the scopolamine. Digging deeper, the researchers learned that berberine increased cholinergic activity. It restored brain-derived neurotropic factor and camp response element binding protein mRNA expression in the hippocampus. And berberine also significantly decreased pro-inflammatory cytokines like interleukin-1 beta, tumor necrosis factor alpha, cyclooxygenase 2 mRNA in the hippocampus. While not considered a first-line treatment for depression, several neurohackers reported the side effect of a better mood when supplementing with berberine. We've some clinical evidence from animal trials that could explain the antidepressant effect of berberine, but no human clinical trials to date. Similar to L-deprenyl, berberine seems to be a monoamine oxidase A inhibitor. The enzyme MAOA is involved in the degradation of norepinephrine and dopamine in the brain. and research has shown that an overabundance of MAOA and B happens as you get older. Inhibiting MAOA increases norepinephrine and dopamine in the brain, which in turn improves your mood. Research with mice has shown supplementing with berberine increases norepinephrine by 31%, serotonin by 47%, and dopamine by 31%. Increasing these major neurotransmitters is certainly going to have a positive effect on your mood. Major depression and anxiety have long been treated as dysfunction of the GABA, serotonin, and the glutamate system in the brain. And while SSRIs and other prescription antidepressants have had some limited success in treating anxiety and depression, full remission of the symptoms has not happened. Some of the latest research has shown that sigma receptors play a role in depressive disorders, and companies are working on developing drugs that modulate sigma-1 receptor, and it turns out berberine is a modulator of the sigma-1 receptor. Probably most celebrated clinical evidence for berberine is its ability to control blood sugar and lipid metabolism in diabetes. Berberine stimulates the uptake of glucose into the cells. It improves insulin sensitivity and it reduces glucose production in the liver. A famous study done in China with adults diagnosed with type 2 diabetes. In the study, patients were randomly assigned a treatment with berberine or metformin 3 times a day for 3 months. The hypoglycemic effect of berberine was similar to metformin. Both decreased the hemoglobin A1C fasting blood sugar and the plasma triglycerides. In another study, 48 type 2 diabetic adults were supplementing with berberine for 3 months. The results were similar to the first study, but the researchers noted total cholesterol and LDL cholesterol also decreased significantly. The researchers concluded berberine is a potent hypoglycemic agent with beneficial effects on lipid metabolism, but without the increased risk of death from heart attack that's associated with metformin. Recommended doses of berberine are 500 milligrams 3 times per day. Berberine has a short half-life, so you need to dose it several times a day to keep it at stable levels in your blood. When you first start supplementing with berberine, you might experience diarrhea, sweating, or even vomiting. The supplement is a powerful antibiotic. The good news is berberine only kills the bad bacteria in your gut, not the good bacteria like you often experience with prescription antibiotics. But note, when these bad bacteria decide to leave your body, you might feel sick, but this side effect is only temporary. You might be able to avoid the unpleasant reaction to berberine by starting with a lower dose at first and working your way up. The debate continues on how bioavailable berberine actually is. Recent reports suggest it's not detectable in blood because it's absorbed so quickly into the cells, but several clinical studies suggest berberine is poorly absorbed. You can improve the absorption of berberine by taking it with sodium caprate, and this comes from coconut oil. It's best to split your dose, so take the 500 milligrams 3 times per day, preferably around 30 minutes before meals. If you're dealing with a medical condition or taking any medication, you should speak to a doctor before taking berberine, especially if you're using blood sugar lowering medication. Diabetics who are controlling blood sugar with insulin must use caution because berberine can also lower the blood sugar. If you're dealing with low blood pressure, you should also be careful using the berberine as this also lowers the blood pressure. If you're pregnant or nursing, you should avoid berberine completely. And berberine inhibits cytochrome P450. This means it can alter the metabolism of other drugs or supplements. Therefore, you should always consult a doctor before taking any supplement. Berberine affects muscle protein synthesis and it causes muscle atrophy, according to some animal studies. So if you're worried about muscle loss, don't use berberine, or amp up your exercise program to counteract this effect. Berberine has a good safety profile. The primary side effect is related to digestion, like cramps, diarrhea, gas, constipation, and stomach pain. Berberine is especially helpful for people who are dealing with diabetes, high cholesterol, obesity, gut bacteria overgrowth, and Alzheimer's. Berberine is a powerful nootropic supplement. It may help to reduce sugar cravings, avoid the afternoon energy slump, boost energy levels, reduce brain fog, improve your mood, and tame digestive issues. You can safely take up to 1500 milligrams of berberine per day if needed, but dosed as 500 milligrams 3 times per day. You can help the absorption by taking the berberine with a tablespoon of unrefined coconut oil. For more information about herbs, supplements, and natural treatment plans, check out my website.